Hello everyone, my name is Dr. Akshit Mittal and I secured a rank of 175 in this year's INI-CET May 2025 exam. I am currently pursuing MS General Surgery at PGI Chandigarh. A little bit about my background. I did my UG from MAMC Delhi. I am 2018 batch student. I finished my internship in March 2024. This was my second attempt. In my first attempt, I got a rank of 14,000 in INI-CET May 24 and a rank of 10,000 in NEET PG 2024. Actually, in MAMC, my ortho posting, my pediatric, I was allotted in peds nursery, my OBG posting, my medicine and surgery, they were very hectic. Like my medicine surgery were in the last, like in January to March 2024. So I was able to read some content in my internships, but I think I wasn't able to practice that many MCQs like while on my internship. Like my first GT was in December 2024, and like everyone, my baseline GT score was very low. Like I think in my first GT I scored 350 to 400 because I started GT very late. Like I gradually progressed to around 450 I think in like Feb, maybe 500 in March, and I think that was my score only in INI-CET. That's why I got that rank. So I suggest if you have like heavy postings in your end, like in like January or February, right before your INI-CET May, like you have to plan according to like that only. Like if like my PSM posting was right in the starting, so I could have covered the major subjects like medicine and surgery in that, along with some other heavy subjects. And in those three clinical postings like radio, derma, psyche, you should first read that respective posting. But I think that subject will take you approximately 1 to 2 days. So finish subjects along with that posting only. And in the hectic postings like OBG, medicine, surgery, I know like me, you'll also don't have the time. But unlike me, apart from revising the content, just focus on MCQs. Like in medicine, while running to get your ABG done, while running to collect your reports done, just open a question bank like custom module of 40 questions and try to solve it like while running to and fro. Because no matter how difficult it is, I think everybody will suggest the same thing. Like it's only because you have to do some things which maybe is very difficult, maybe you don't like it, but that's how it goes. Like if you have such hectic internship. So after my INI-CET May result, I think I started to grasp, like I started to get a hold of my subjects. I started to give a little bit more GTs. That's why my rank shifted from 14K to 10K. But I know that wasn't my best attempt because, like as you can understand, my internships I didn't read that much. I didn't practice that much MCQs. But I could have gotten a college. I could have I was always interested in surgery, so I could have gotten any college of surgery in my hometown only. But I think I know I was more of deserving of a central institute. So I talked to my friends, I talked to my mentor, I talked to my parents, and all of them said the same thing. Like if even if you have gotten a good rank, and even if you could get like a branch of your choice, but maybe not the college of your choice, and you think you can perform better next year, then you can definitely go for it. Because I know there's like unsurety of whether you will be able to perform next year or not, because after all the competition is rising every year, and every year the people are getting more scores, the inflation is getting like hell crazy. But if you think you'll also like manage to like perform better than this year, if you can just be consistent, because this journey is a marathon. You can't just expect someone to read in 15 to 20 days and get a rank of 100. It's just not possible. This journey is a marathon. You just have to take some baby steps daily. Like even if you have some bad days, even if in your postings your senior grinds you that much, like even if after your postings like you'll feel that you just can't do it, even if you have some thoughts of changing your branch, I think that's the main thing like any topper can say, because that's the main thing your rank will decide. Even if you are not able to study, just open any random video of any teacher open any random QBank, open any random images, just read your notes passively, because with each baby step ultimately all will add up in the end. Trust me, everything definitely does add up in the end, because I'm on the other side and I have faced like every situation like there is. So coming to how to actually plan your journey, I think there are four main things you have to focus. First of all, your content, second, your MCQ practice, third, your GTs, and fourth, your final revision. Uh, Talking about the main notes, I think I did my main notes from Marrow only in my UG days, except for some subjects like Path from Spurs sir, Pharma from GRG sir, PSM from Vivek sir, Psyche from Praveen sir, and Ortho from Apu sir. But rest of the subjects I did from Marrow. But as you all know, Marrow's notes are densely vast, especially medicine. So I wasn't able to revise that much content in the last days, and I fumbled a little bit. I actually left many of the topics in INI-CET May, so I needed some content to concise my notes such that I could finish all of the syllabus in the last 15 to 20 days. That's why I subscribed to mission videos, and I think they are a perfect baseline. They are a perfect midline in between the main notes as well as in the short courses. So since it was my repeat year, so I used to follow all the mission videos live. But I think some of you are like planning to give your first attempt, and I think many of you have having very difficult internship postings going on. So you can also watch them recorded. Like Cerebellum used to send that annotated PDF one day before, and annotated PDF makes your job very easier. So you can watch the video in 2x, 1.5x, and you can just read that annotated PDF. Even for some subjects, I also read it annotated PDF only. Coming to the MCQ practice, like my approach was just to if you are starting now, there are many older TNDs available in the Cerebellum app itself. So before watching the video, I used to attempt an earlier TND, and after watching the video for 4 to 5 days, I used to give a TND after test, so that I used to know which topics I am still getting wrong after watching that video, and I used to mark that subject in my notes, and I used to read that topic immediately, and then I move on to the next subject. So I think that pre and post test helped me a lot. Coming to the GTs, I think GTs are the main thing which can prepare you for the final exam, because ultimately no matter how long your preparation is, it's only a matter of 200 questions in those 3.5 hours, like INICET versus NEET PG. So I think GTs are the main thing which can definitely prepare you for the main exam. And all of you and like me, I also struggled very much giving my first GT, because as all of you know, your first GT scores are terrible, very terrible. So what helped me is that I think many of us can practice a question, like a custom module of 200 questions, but most of us will not be able to tolerate a GT of 200 questions, because in a GT you also have that separate anxiety of how well you are performing. Alongside GT, you are analyzing how well your GT is going. So if you just keep that feeling aside and just analyze your GT and give your GT like it's just a custom module of 200 questions, or it's just a custom module of 40 questions 5 times, I think that will help your anxiety a lot. So before giving GT, you just start doing custom modules of 40 questions, 42 minutes, and analyze your GT, give your GT like that only. So for the first few GTs, definitely you will get your anxiety a little bit less, and with every GT, I think you'll get the hold of it. And try to give GT not just in a 200 question continuous manner. Try to give GT as your exam will come, 40 questions in 42 minutes, or 40 or 50 questions in 45 minutes, depending on the exam. But giving GT is one thing, analyzing GT is the main thing which can help you progress further. What I used to do is I used to analyze GT subject wise. Some people say that you can also analyze it correct, incorrect, and left, but I used to do it subject wise, because giving GT you have to give GT as mix, any subject can come at any time. But analyzing your GT as subject wise can also alter your mind. In your mind you're very fixed. If you're reviewing anatomy questions, your automatically brain sets anatomy perspective. So while reviewing your correct, incorrect, and left questions, you'll automatically get to know which topics you're weak in subject wise. So if you're getting a subject wrong first time, you just read that topic instantly, immediately. But if you're getting a topic wrong second time or third time, that's the time you have to realize that this is a serious thing. So what I used to do is, if I get a topic wrong first time, I used to immediately read it. But if I get a topic a second time or third time wrong, I have a piece of paper in which I used to write topics, only topics, not content, only the topics which I got wrong. So ultimately, after 6, 7, maybe 10 GTs, you'll have a piece of paper in which all those topics were mentioned which you have repeatedly getting wrong. And if your topic is getting wrong 4, 5, maybe 6 times, that's the point you have to add that topic in your 20th notebook, maybe a paragraph or two, like 2 or 3 paragraphs. So that's the way to analyze your GT. If coming to the 20th notebook, all of you have already heard about the 20th notebook. 20th notebook is a very personal thing. My 20th notebook usually contained the topics which I have gotten wrong like 5 to 6 times. All of the scoring systems, all of the classification systems, all cancer TNMs in one place, because INI-CET is very fond of asking cancer TNMs, especially cancer TNMs image based. So I don't think you'll find it on any platform, but for some things you'll have to Google it. You'll have to copy and paste the image in your respective notes for some of the important cancers TNM. And for INI-CET only, I think genes, their locations, their chromosomes, they also are very important. I used to have them separately in my 20th notebook. And I think what I did differently is I also had a topic of lymph nodes, like all the sentinel lymph nodes training in one place, and that question also came in this year's INI-CET May, and all of the incisions images at one place. So any of the stuff and that you find similar stuff like incisions, like lymph nodes, which you find in different subjects, you should definitely write in one place so that it's easier for you to revise them again and again. Also, one thing I like to add is the time of surgeries. Like for example, we know for cleft lip, cleft palate, we have to do the surgery at a specific time. For ear cartilage, it has to do at a specific time. For meatal plasty, you have to do it at a specific time. For unilateral cataract, there is a specific time. So all those specific times you can also write in one place. So what separates you from a topper is like all these toppers usually have these integrated stuff in one place only. And if anybody hasn't told you already, PYQs are definitely a must. NEET, not like NEET, but INI-CET tend to repeat these repeated year PYQs very repeatedly. Like I remember the topics that I have gotten wrong in INI-CET May 2024 exam or INI-CET November 2024 exam. Those same questions came in INI-CET May 2025, and I literally as I was solving those questions in my screen, I actually was laughing since I got them wrong the last year. So PYQs are definitely must. So there are two ways of solving PYQs. One thing is you can do the PYQs subject wise, like giving anatomy 2017 2018 onward subject wise, or you can do cerebellums has recently launched a new feature of midday modules and late night modules, and I think that's definitely a very good feature. I used to attend all of these features very punctually because I had already solved these PYQs in between INI-CET May and NEET PG. And after solving those PYQs for enhancement of my revision, I used to attend these modules because giving them subject wise once is okay because it gives you a sense of completion, but solving PYQs randomly without knowing the subject is very important. So either you have to make a custom module, or Cerebellum makes your job easier by already making a custom module in the form of midday modules or late night modules. It's your wish how to solve them. My seniors also told me that if close to the exam, you can also practice giving a previous year question, previous year exam. Since my NEET PG 2024 was evening shift, I attended morning shift like a GT only. So you can also do after, even if you have solved PYQs, you can definitely attempt previous year papers like that only. And while going through PYQs, not just solve the PYQs, analyze which topics have been repeatedly frequently repeated, because only those topics will be frequently repeated again and again. Like INI-CET tend to repeat those same topics only. But also analyze which subject has most theory questions asked, which subject has most image questions asked, which new topics are being added for. Like example, transitional epithelium question is being coming 3 times in the last 5 exams that I gave. So histopath, eye, derma, surgical images, like which surgery is being performed, like that kind of image based questions are a pet favorite for INI-CET. So MCQ practice, content, GTs are being done. Coming to the final revision, because all of these things that you're doing, ultimately what what make you progress is that final revision of last 15 to 20 days. One thing I can also add in the in the GT section, analyzing your GT scores. I think if you're not reaching 120, I think your content, this is what Zainab ma'am actually told us. I am just repeating the words of Zainab ma'am. Like if you're not reaching 120, I think your content is definitely lacking. So you need to watch RR videos or mission videos, like as you're comfortable with. If you're reaching 120 to 140, I think your content is good enough, but your revision is lacking. So for making your revision effectively, what I used to do is, if I getting a GT mistake wrong, or if I'm getting any Q bank wrong, I used to mark it in a different color in my notes. So when I go in my subsequent revision, I from far only I know this was my GT mistake, since it was in different color. So that helped me analyzing my GT mistakes better, like while going through my notes. So one thing you can do is this. But if you are stuck in 140 to 150, maybe 155 zone, I think your revision is also good. But what you have to master is your MCQ practice, because ultimately it's just one question and 4 options. And like Zainab ma'am says, it's answer won't come from your notes, answer won't come from your memory, answer will only come from those 4 options. Because as we all know, INI-CET has a very much controversial questions, and some of the controversial questions are there in NEET too. So select the most appropriate option which you feel like while giving the exam, and you can master that ability only after giving more and more GTs, more and more custom modules only. So coming to the last final revision of 15 to 20 days, at that time I think you will have your piece of paper ready, in which your topics of 2 to 3 times which you've been getting wrong is there. Your 20th notebook will be ready, and mainly I think your concise notes will be ready. Like if your main notes is BTR, you could just add some of the mission notes in your BTR notes. And if your main notes is those BTR slide, is your mission slides, then you can add BTR stuff to that mission slides. Final revision of 15 to 20 days shall comprise of your list of topics that you are getting wrong, your 20th notebook, and maybe your PYQ mistakes that maybe you have written someplace, even you have bookmarked, or you've written separately along. So that will comprise of your 20th notebook, and last 15 to 20 days. And I think so I heard that one time, brain is like a muscle. You have been grinding it for so long, just give your brain a rest 1 day or 1.5 day before. Even if you have to do, even if you are getting a FOMO that you are not doing anything for the last day, just have a chart or two or some value charts that you have prepared, and just go through them passively, because you need to have your brain rest for the last day, such that you'll have your brain at your maximum capacity on the day of the exam. Coming to the BTR, I think everybody has done BTR at this point, there's no denying it. And BTR itself is not that much enough, but supplementing it with mission notes and RR notes is definitely enough. But even doing BTR has a very different technique for everybody, and I think many of us will agree that even if I ask something, or Zainab ma'am asks something in a BTR, maybe will not be able to respond, because how we are reading the BTR, because most of us passively read BTR. So like what I liked the method is you'll open the BTR in split screen. In one screen you'll have like blank BTR, in the other screen you'll have a properly filled BTR. So just read the blank BTR and fill in the blanks. Just answer that blank in your mind and just confirm it with the properly filled one. Like this is what active recall is actually like, and this is what actually will make you help uh, regain and help learn stuff and memorize stuff and retain stuff for much longer. So that's it from my side. All the best. Like I'll see you on the other side. Hopefully you'll all get to come to PJ. Thank you.